polish cut.
The objective in any scrub technique is to reduce the number of bacteria on the hands and arms. Highly detergent soaps which contain various antimicrobial agents are used. In contrast to the requirements for hospital operating rooms, an acceptable scrub procedure for outpatient oral surgery is a modified but short 5-minute scrub. The equipment needed for this scrub procedure includes a faucet from which the flow of water is controlled by a foot or a knee action lever, surgical soap for preliminary scrub, and sterile towel pack and sterile disposable scrub sets, which contain soap, nail file, and brush. The scrub is begun by a preliminary wash of the hands and forearms for 1 minute to remove gross contamination. Please note that the preliminary scrub must be carried to the elbows. Wash the lather under and around the nails. Interlace the fingers of the hands by moving back and forth to provide friction. Clean the nails with a nail file under running water. And rinse, allowing the water to flow from the fingers toward the elbow. The second stage of the scrub technique is done with brush and soap and using rotary strokes. Under running water, squeeze the brush to produce lather. Begin the scrub at the fingertips and nails. Then proceed in an orderly manner from the nails toward the elbows without returning to areas which have already been scrubbed. Each hand and forearm, including the elbow, is scrubbed thoroughly for 2 minutes. Treat each finger as a 4-sided object and scrub each side in turn, including the webbing between the fingers. Extend the fingers of the hand and scrub the palm thoroughly. Continue the scrub by progressing upward to the wrist, forearm, and elbow. After scrubbing, drop the brush into the sink and rinse under running water by allowing the water to flow from the fingertips to the elbow. Remember, always keep the hands and arms higher than the elbows. Thorough drying is essential to reduce the possibility of contamination and to facilitate gloving. Grasp one corner of the folded sterile towel and shake gently to open fully. Bend forward slightly to avoid touching clothing or any other object. Place one end of the sterile towel on the palm of the opposite hand and dry systematically by advancing the towel from fingers to elbow. After drying one hand and arm, take the unused end of the towel and dry the other hand and arm. Remember, never carry the towel back over an area which has previously been dried. The open gloving method is used in the outpatient clinic. Gloves are packaged in a palms up, thumbs out position. The cuff, about 2 inches wide, is turned back to make it possible to put on gloves without touching the outside of either glove with the bare hand. To put on the first glove, grasp the cuff and only touch the inside surface of the glove. Visualize the location of the thumb and fingers, insert the hand, and pull the glove into position and release the cuff. Do not touch outside of the glove with the bare hand. To put on the second glove, insert the glove fingers under the cuff and pull the glove into place. Guard against contaminating the glove thumb on the bare arm during this process. Gloved hands are always held higher than the waist.